Lung cancer is a serious disease that begins in the lungs, the two spongy organs in your chest that take in oxygen when you inhale and release carbon dioxide when you exhale. This condition starts when cells in the lung begin to grow out of control. Instead of developing into healthy lung tissue, these abnormal cells divide rapidly and form tumors. These tumors can grow very large and interfere with the normal functioning of the lungs, making it difficult to breathe. It is a major health concern across the globe, affecting millions of lives each year. Understanding this disease is the first crucial step towards fighting it, both for individuals and for our communities. It is a battle that requires knowledge, awareness, and collective action. Why does this matter so much to us here in India and all over the world? The reason is simple. Lung cancer is one of the most common and deadliest cancers. It often goes undetected in its early stages when it is most treatable. By the time symptoms like a persistent cough, chest pain, or unexplained weight loss appear, the disease may have already advanced. This makes early awareness and understanding incredibly important. The impact of lung cancer extends beyond the patient. It affects families, friends, and entire communities. The emotional and financial burden can be immense. Therefore, spreading knowledge about its causes, symptoms, and treatments is not just a medical necessity, but a social responsibility we all share. The global statistics paint a very stark picture of the challenge we are up against. Every year, lung cancer claims more lives than breast, colon, and prostate cancers combined. In India, the numbers are particularly worrying, with a rising incidence rate linked to factors like smoking and increasing air pollution in our cities. This is not just a problem for the elderly, it can affect people of all ages. The disease does not discriminate. However, the story of lung cancer is not one of despair alone. It is also a story of incredible scientific progress and resilience. Medical science is constantly evolving, bringing new hope and better outcomes for patients every single day. This essay aims to be your guide to understanding this complex disease. We will break it down into simple, easy-to-understand parts. We will explore what causes lung cancer, from the most obvious culprits to the hidden ones. We will look at how doctors find and diagnose it. Then, we will journey through the different treatment options available today, from traditional methods to the latest cutting-edge therapies that are changing the face of cancer care. Finally, we will talk about what you can do to lower your risk and end with a message of optimism. Knowledge is power, and by arming ourselves with it, we can face the challenge of lung cancer with courage and hope. When we talk about lung cancer, one cause stands head and shoulders above all others: smoking tobacco. It is the single biggest risk factor responsible for the vast majority of lung cancer cases worldwide. The link is direct and undeniable. Cigarette smoke is not just smoke, it is a toxic cocktail of more than 7,000 chemicals, and at least 70 of them are known carcinogens, meaning they are proven to cause cancer. When you inhale this smoke, these dangerous chemicals enter your lungs and immediately start to damage the delicate lung tissue. The body has its own repair mechanisms, but with repeated exposure, these systems get overwhelmed and can no longer keep up with the damage. Think of it like this. Your lung cells are constantly being attacked by the poisons in tobacco smoke. Over time, this relentless assault can cause changes in the DNA of the lung cells. DNA is like the instruction manual for your cells, telling them how to grow and function properly. The carcinogens in smoke can corrupt this manual, causing cells to mutate and grow uncontrollably. This is the very beginning of cancer. The longer a person smokes and the more cigarettes they smoke per day, the higher their risk becomes. It is a cumulative effect. Every single cigarette contributes to the damage, slowly but surely paving the way for the disease to take hold. It is not just active smoking that is dangerous. Secondhand smoke, also known as passive smoking, is also a serious threat. This is the smoke that is exhaled by a smoker or comes from the burning end of a cigarette, pipe, or cigar. When non-smokers breathe in this smoke, they are also inhaling the same cancer-causing chemicals. This is why it is so important to have smoke-free homes, workplaces, and public spaces. Many people who have never smoked a single cigarette in their lives develop lung cancer simply because they were regularly exposed to the smoke of others. The risk is very real, and it underscores the fact that smoking is not just a personal choice, but a public health issue. The good news in all of this is that the damage is not always permanent. Quitting smoking is the most significant step a person can take to reduce their risk of developing lung cancer. The benefits start almost immediately. As soon as you stop smoking, your body begins to heal itself. Over the years, the risk of lung cancer drops dramatically. After about 10 to 15 years of quitting, the risk can become nearly as low as that of a person who has never smoked. It is never too late to quit. The decision to stop smoking is a powerful investment in your future health, a definitive action that can literally save your life and protect the health of those around you. While smoking is the leading cause, it is crucial to understand that it is not the only one. A significant number of lung cancer cases occur in people who have never smoked. This is why we must look beyond tobacco to understand the full picture of this disease. One of the major non-smoking risk factors is exposure to radon gas. Radon is a naturally occurring radioactive gas that is invisible, odorless, and tasteless. It is released from the normal decay of uranium in soil, rock, and water. It can seep into homes and buildings through cracks in the foundation, and once inside, it can accumulate to dangerous levels. When you breathe in radon, it can damage your lung cells, increasing your risk of lung cancer over time. Another significant contributor, especially in urban areas and industrial zones, is air pollution. The air we breathe in many of our bustling Indian cities is filled with a mixture of harmful particles and gases. These pollutants come from vehicle exhaust, factory emissions, and the burning of fossil fuels. Fine particulate matter, often called PM 2.5, is particularly dangerous because these tiny particles can travel deep into the lungs and become lodged there. Long-term exposure to this polluted air can cause chronic inflammation and cellular damage, which are known precursors to cancer. Living in a highly polluted city for many years can significantly increase a person's risk of developing lung cancer, even if they are a non-smoker. Occupational exposure to certain hazardous substances is another important cause. People who work in specific industries may be regularly exposed to carcinogens in their workplace. For example, asbestos, a mineral that was once widely used in construction and insulation, is a potent cause of a specific type of lung cancer called mesothelioma. Other dangerous materials include arsenic, silica, chromium, and diesel exhaust. Workers in fields like mining, construction, and certain types of manufacturing must take proper safety precautions, such as wearing protective masks and ensuring good ventilation, to minimize their exposure and reduce their long-term risk of developing lung cancer and other respiratory diseases. Finally, genetics and family history can also play a role. Some people may inherit a genetic predisposition that makes them more susceptible to developing lung cancer. If you have a close relative, a parent, sibling, or child who had lung cancer, your own risk may be slightly higher. This does not mean you will definitely get the disease, but it suggests that your genes might make your lung cells more vulnerable to damage from carcinogens. Sometimes, specific inherited gene mutations can directly increase the risk. Understanding your family's medical history can be an important part of assessing your own personal risk and can encourage more vigilant health monitoring throughout your life. Diagnosing lung cancer often begins when a person experiences symptoms and visits their doctor. Common symptoms that might raise a red flag include a cough that doesn't go away or gets worse, coughing up blood, chest pain that is often worse with deep breathing or coughing, hoarseness, loss of appetite, and shortness of breath. The doctor will start by taking a detailed medical history, asking about symptoms, smoking history, family history of cancer, and any occupational exposures. This is followed by a physical examination, where the doctor listens to the lungs and checks for any other signs of illness. These initial steps are crucial for gathering clues and deciding what to do next. If the doctor suspects lung cancer, the next step is usually an imaging test to get a look inside the chest. The most common first test is a chest X-ray, which can reveal any abnormal masses or nodules in the lungs. However, an X-ray might not be able to detect very small tumors or provide enough detail. Therefore, a computed tomography or CT scan is often recommended. A CT scan uses X-rays and a computer to create detailed cross-sectional images of your lungs. It can show the size, shape, and position of any tumors much more clearly than a standard X-ray. Other imaging tests, like a PET scan, might also be used to see if the cancer has spread to other parts of the body. While imaging tests can show the presence of a suspicious mass, they cannot definitively tell if it is cancerous. For a confirmed diagnosis, a sample of the abnormal cells must be collected and examined under a microscope by a specialist called a pathologist. This procedure is called a biopsy. There are several ways to perform a biopsy depending on the location and size of the tumor. One common method is a bronchoscopy, where a thin, lighted tube is passed down the throat and into the lungs to collect a tissue sample. Another method is a needle biopsy, where a thin needle is inserted through the chest wall and into the tumor to withdraw a sample, often guided by a CT scan. Once the biopsy sample is analyzed, the pathologist can confirm whether cancer cells are present. If it is cancer, they will also determine the specific type of lung cancer. The two main types are non-small cell lung cancer, which is the most common, and small cell lung cancer, which is more aggressive and often linked to heavy smoking. Knowing the exact type and stage of the cancer, how far it has spread, is absolutely critical. This detailed diagnosis is the foundation upon which the entire treatment plan is built, allowing the medical team to choose the most effective and personalized approach for the patient. The diagnostic journey is a careful, step-by-step process to ensure the right path is taken. For many patients diagnosed with early-stage lung cancer, surgery offers the best chance for a complete cure. The primary goal of surgery is to physically remove the cancerous tumor, along with a margin of surrounding healthy tissue, to ensure that no cancer cells are left behind. This approach is most effective when the cancer is confined to a specific area within the lung and has not spread to the lymph nodes or other distant parts of the body. The decision to proceed with surgery depends on several factors, including the type and stage of the cancer, the location of the tumor, and, very importantly, the overall health and lung function of the patient. The medical team must be confident that the patient is strong enough to withstand the operation. There are different types of surgical procedures for lung cancer, and the choice depends on the size and location of the tumor. If the tumor is small and located in a limited area, a surgeon might perform a wedge resection, which means removing a small, wedge-shaped piece of the lung, or a segmentectomy, which involves removing a larger segment of the lung. For larger tumors, a lobectomy, removing an entire lobe of the lung, is the most common and often preferred operation. In more extensive cases, a pneumonectomy, the removal of an entire lung, might be necessary, though this is less common today due to its significant impact on breathing. In recent years, surgical techniques have advanced significantly, making operations safer and less invasive for patients. The traditional approach is a thoracotomy, which involves making a long incision in the chest to open up the chest cavity and access the lung. While effective, this is a major operation with a longer recovery time. Today, many surgeons use video-assisted thoracoscopic surgery, or VATS. In VATS, the surgeon makes a few small incisions and inserts a tiny camera and special surgical instruments. The camera sends a live video feed to a monitor, allowing the surgeon to see inside the chest and perform the operation with much less trauma to the body. This minimally invasive approach often results in less pain, a shorter hospital stay, and a quicker recovery. After the surgery, the recovery process is carefully managed. Patients will experience some pain and discomfort, which is controlled with medication. They are encouraged to start moving around as soon as possible to prevent complications like blood clots and pneumonia. Breathing exercises are a critical part of rehabilitation, helping the remaining lung tissue to expand and function more efficiently. The path after surgery requires patience and perseverance, but for many, it represents a decisive victory against the disease. Removing the cancer physically provides a clean slate, often followed by other treatments to ensure the cancer does not return, setting the stage for a long and healthy life. When surgery is not an option, or when cancer has spread beyond the lung, doctors turn to other powerful tools to fight the disease. Two of the most established and effective treatments are chemotherapy and radiotherapy. Chemotherapy, often simply called chemo, uses powerful drugs to kill cancer cells. These drugs are typically administered intravenously, through a vein, or sometimes as pills. They travel throughout the bloodstream, reaching cancer cells almost anywhere in the body. This makes chemotherapy a systemic treatment, meaning it treats the whole body. It is particularly useful for cancers that have metastasized or spread to other organs beyond the lungs. The goal is to destroy the rapidly dividing cancer cells. However, chemotherapy is like a broad-spectrum weapon. It attacks all rapidly dividing cells, not just the cancerous ones. This is why it causes side effects. Healthy cells that also divide quickly, such as those in the hair follicles, the lining of the mouth and stomach, and the bone marrow, which produces blood cells, can also be damaged. This can lead to side effects like hair loss, mouth sores, nausea, and fatigue. Doctors are very skilled at managing these side effects with other medications and support. Chemotherapy is usually given in cycles, with a treatment period followed by a rest period. This gives the body a chance to recover and rebuild its healthy cells before the next round of treatment begins. Radiotherapy or radiation therapy is another cornerstone of lung cancer treatment. It uses high-energy beams, such as X-rays or protons, to target and destroy cancer cells in a specific localized area. Unlike chemotherapy, radiotherapy is a local treatment. The radiation is carefully aimed at the tumor, damaging the DNA of the cancer cells within the beam's path and causing them to die. This can be used as the main treatment for patients who cannot have surgery, or it can be used after surgery to kill any remaining cancer cells and reduce the risk of the cancer coming back. It can also be used to shrink tumors before surgery, making them easier to remove. Radiotherapy is often given in combination with chemotherapy, a strategy known as chemoradiation. This combined approach can make the cancer cells more sensitive to radiation, making the treatment more effective. Like chemotherapy, radiotherapy can also have side effects, which are usually limited to the area being treated. For lung cancer, this might include skin irritation on the chest, a sore throat, fatigue, and a cough. Modern radiation techniques like intensity-modulated radiation therapy, or IMRT, allow doctors to shape the radiation beams very precisely to conform to the tumor, delivering a high dose to the cancer while sparing the surrounding healthy tissues, thereby reducing side effects. In the last decade, the landscape of lung cancer treatment has been completely revolutionized by two new classes of drugs, immunotherapy and targeted therapy. These treatments represent a more intelligent and precise way of fighting cancer. Targeted therapy works by identifying and attacking specific genetic mutations or proteins that are present on cancer cells and help them grow and spread. Before starting this treatment, doctors perform advanced molecular tests on the tumor biopsy sample to look for these specific targets. If a target is found, a drug designed specifically to block that target can be used. This is the essence of personalized medicine. For example, some non-small cell lung cancers have mutations in a gene called EGFR or an arrangement in a gene called ALK. There are now specific pills that patients can take which are incredibly effective at blocking the signals from these faulty genes, causing the cancer cells to stop growing and die. These targeted drugs are often much less toxic than traditional chemotherapy because they are designed to attack the cancer cells specifically, leaving most healthy cells alone. This results in fewer side effects and a much better quality of life for the patient. The discovery of these targets and the development of drugs to hit them has been a massive breakthrough, especially for patients with advanced non-small cell lung cancer. Immunotherapy is another game-changing approach that works in a completely different way. Instead of attacking the cancer directly, immunotherapy harnesses the power of the patient's own immune system to fight the cancer. Our immune system is designed to find and destroy foreign invaders like bacteria and viruses, as well as abnormal cells like cancer cells. However, cancer cells are clever and can develop ways to hide from the immune system or switch it off. They can put up a stop sign to tell the immune cells to leave them alone. Immunotherapy drugs, known as checkpoint inhibitors, work by blocking these stop signs. By blocking these signals, immunotherapy essentially releases the brakes on the immune system, allowing it to recognize the cancer cells as a threat and attack them. This has led to remarkable and long-lasting responses in some patients with advanced lung cancer, something that was almost unheard of with older treatments. For certain patients, immunotherapy has turned what was once a rapidly fatal disease into a manageable, chronic condition. Doctors can test the tumor for a protein called PD-L1, which helps predict how well a patient might respond to this type of treatment, further personalizing the therapeutic approach and offering hope where there was once very little. While medical science has made incredible strides in treating lung cancer, the most powerful strategy of all remains prevention. Taking proactive steps to protect your lungs is something everyone can and should do. The single most effective preventive measure is to not smoke tobacco. If you are a smoker, quitting is the best gift you can give to your lungs and your overall health. It can be very difficult to quit, but there is a lot of support available, from counseling and support groups to nicotine replacement therapies like patches and gums. Every day you are smoke-free, you are lowering your risk. If you are a non-smoker, it is vital to avoid exposure to secondhand smoke by insisting on smoke-free environments at home, in the car, and in public places. Protecting yourself from environmental and occupational hazards is the next critical step. You can have your home tested for radon gas, which is a simple and inexpensive process. If high levels are found, there are proven methods to reduce the radon concentration and make your home safe. When it comes to air pollution, while it may be difficult to control the air quality of an entire city, you can take personal measures. On days with high pollution levels, try to limit strenuous outdoor activities. Using air purifiers in your home can also help to filter out harmful particulate matter. If your job exposes you to dust, fumes, or chemicals, always use the recommended protective equipment, like masks and respirators, and ensure your workplace follows all safety guidelines. A healthy lifestyle also plays a significant role in reducing your overall cancer risk, including lung cancer. Eating a balanced diet rich in fruits and vegetables is very important. These foods are packed with vitamins, minerals, and antioxidants that can help protect your cells from damage. Some studies suggest that a diet high in fruits and vegetables may offer a protective effect against lung cancer, especially for smokers. Regular physical activity is another cornerstone of good health. Exercise strengthens your lungs and your immune system, helps you maintain a healthy weight, and reduces your risk of many chronic diseases, including several types of cancer. Finally, being aware of the early signs and symptoms of lung cancer can lead to earlier diagnosis and better outcomes. Do not ignore a persistent cough or unexplained chest pain. If you notice any concerning symptoms, see your doctor without delay. For individuals who are at high risk, such as long-term heavy smokers, annual screening with a low-dose CT scan may be recommended. These scans can detect lung cancer at a very early stage, often before any symptoms have developed, when the chances of a successful cure with treatment are at their highest. Taking charge of your lung health through these preventive actions is a powerful way to fight lung cancer before it even has a chance to start. The story of lung cancer is no longer just a narrative of fear and loss. It is increasingly a story of hope, resilience, and remarkable scientific progress. Not long ago, a diagnosis of advanced lung cancer came with a very grim prognosis. The treatment options were limited and often came with harsh side effects. But today, that picture has changed dramatically. We have entered a new era of cancer care, driven by a deeper understanding of the biology of the disease. The pace of discovery is breathtaking, and with each passing year we are equipped with better, smarter, and more effective ways to fight this illness. This progress provides real, tangible hope to patients and their families around the world. The shift towards personalized medicine has been a true game changer. Instead of a one-size-fits-all approach, we can now tailor treatments to the specific molecular characteristics of an individual's tumor. The development of targeted therapies and immunotherapy has transformed outcomes for many patients, allowing them to live longer, fuller lives with a better quality of life. Clinical trials are constantly testing new drugs and new combinations of treatments, pushing the boundaries of what is possible. Research into areas like liquid biopsies, which can detect cancer through a simple blood test, promises to make diagnosis even earlier and less invasive in the future. The fight is becoming more intelligent and more strategic. This wave of optimism is also fueled by a growing global awareness of the importance of prevention and early detection. Public health campaigns against smoking have had a massive impact, and efforts to create smoke-free environments are protecting millions from the dangers of secondhand smoke. Increased advocacy for cleaner air and safer workplaces is slowly addressing the environmental and occupational risks. As more high-risk individuals get screened, we are finding cancers earlier when they are most curable. This collective effort, from scientists in the lab to doctors in the clinic, and from policymakers to every individual making healthier choices, is what propels us forward. In conclusion, while the challenge of lung cancer remains significant, we have every reason to be hopeful. The future of lung cancer treatment is not just about extending life, but about improving it. It is about turning a deadly disease into a manageable one, and for an increasing number of people, achieving a complete cure. The journey for a patient with lung cancer can be difficult, but they are not walking it alone. They are supported by dedicated healthcare professionals, innovative researchers, and a world that is more committed than ever to conquering this disease. The progress is real, the hope is justified, and the future looks brighter than ever before.